Doctors who have given a second opinion diagnosis. What is the worst first opinion you've ever encountered? Well, when I first started feeling sick the October of one year at college, I had a non-productive cough, night sweats and trouble sleeping, and I had lost some weight. The school nurse gave me Claritin. All of those symptoms got worse. Plus I was incredibly fatigued. My lymph nodes swelled up, and I had pretty bad backaches. My GP took a chest x-ray and prescribed antibiotics for pneumonia. At this point I had almost failed out of school because I was only managing an hour or two of sleep per night. It took until spring break for me to go see a pulmonary specialist. He could instantly tell that it wasn't pneumonia. I had stage 4B Hodgkin's lymphoma. My first PET scan showed cancerous cells in lymph nodes in all 4 quadrants of my body. At this point I had lost about a third of my body weight. The cough, weight loss, and back pain were my swollen lymph nodes pressing on my lungs, stomach, and my back. They gave me my first round of chemo, and I genuinely felt incredible. I felt like such shit that a fourth mixture of carefully measured toxins was an improvement. I went home and ate a whole pizza. Chemo got shittier but it worked. So I guess I can't complain too much. Glad you're okay. What a horribly frightening experience that must have been. Stay with us, friend. Not me but my mom. She was always exhausted. The type of exhaustion that she'd have a bath, be so tired from it, she'd sleep on the bath mat when she got out. Went to her doctor, told her, "Oh, you're just depressed. Go get a haircut." She did. Still exhausted. Went back to the doctor. Continued to tell her she's just depressed. Get a hobby. It's all in her head, etc. Never sent her for blood work. Never referred her to any specialist. Months later she goes back. Her doctor is on vacation. Physician reliving her doctor takes one look at her eyes and says, "It's your liver. Get these blood tests now. Abnormal blood work and a liver biopsy later." She was told she had autoimmune hepatitis and was 3 months from death. After she improved with medications, she went back to the original doctor and said, "I didn't need a haircut." 27 years later she still suffers from lingering effects. I went to my doctor and told him I must be depressed, even though I didn't feel sad or anything, because I had no energy and wanted to sleep 24/7. No motivation to do anything. He wrote me a prescription for an antidepressant, but looked back at me on the way out of the room and said, "Let's get your thyroid checked. Something about you looks like a thyroid issue." It was a thyroid issue. I feel terrible for your mom. My girlfriend had a similar situation. Thyroid condition that caused some serious weight gain. About 5 stone over a year. Plus depression and irregular periods and a whole slew of other symptoms. First doctor's verdict: "You're probably just sad that you're getting fat." Apostrophe. I'm a surgeon. Most patients come to me after having seen another physician who has diagnosed them with something and told the patient to see a surgeon. I've been called to see more than one patient for appendicitis who has already had an appendectomy. I've also been called in multiple cases for patients who very obviously have previously undiscovered, very advanced cancer. It always too far advanced for me to be of help. So I have to wonder, am I being called so I can be the bad guy and explain everything? Yes. The answer is yes. I have one that happened to me. I did college gymnastics. My senior year I had an accident in practice landing in my neck. Went to the hospital, got x-rays. Was told I was perfectly fine. Walked around in pain for a while. Weeks later went to another doc, got a new set of images. My neck was broken in 3 places and had a dislocation. Had a multi-level fusion surgery days later. Found out my x-rays got swapped with someone else's in the year, and I was originally diagnosed based on someone else's images. This was found out when I went to get my records long after my surgery for insurance purposes, and my files had someone else's medical records and images in it. Because of the time I spent walking around with it, I had to have a posterior surgery instead of anterior, which is way more invasive and gives me major issues to this day. What happened to the person who was misdiagnosed as having a broken neck? Question mark? Question mark? I have no idea. I didn't know about the swap until after my surgery. Good question though. I'm a lawyer, but Had a client given a devastating diagnosis of an extremely rare heart condition. Doctor told him he had 6 weeks to live. He contacted me to make his will and set his affairs in order. Thankfully, he sought a second opinion with an extremely well-known cardiologist. I guess the cardiologist was intrigued due to the rare nature of this heart condition. There was nothing wrong with him. He was fine. This poor guy and his family were tortured over this. So devastated and terrified. For nothing. He actually called me to tell me all of this. He seemed to be still in the joyous, I'm not going to die stage. But I imagine anger comes at some point when you take stock of what you went through. I don't know how a doctor fucks up that massively, or if somehow my client's results were mixed up with someone else's, and some poor bastard's number is almost up, and they don't even know it. I had a very slightly similar situation, where I went to walk-in clinic for some dizziness/nausea and the doctor there very much made it seem like I had a life-threatening illness, and recommended I immediately visit the ER. He basically said, well, these are the innocuous causes of dizziness. We ruled them all out. So, I spent like 10 minutes driving from the clinic to the hospital thinking I was going to have brain cancer and wondering how to tell my family, only to very quickly learn upon arriving that this particular clinic was well known for referring anything to the ER if the diagnosis wasn't immediately obvious and scaring the shit out of their patients in the process. Doc wasn't worried at all. I was fine. As someone who has worked in the ER, we absolutely hate doctors or clinics that would do this bullshit. It's called the emergency room. For emergencies only. Doctors and clinics need to do their freaking jobs too. Not a doctor. My sister was about 2 weeks away from giving birth when she suddenly started feeling excruciating pain and vomiting. I called her midwife, who refused to speak with me despite my sister clearly not capable of speaking, as she sat on the floor next to the toilet, crying and puking. Finally she just took the phone and was told by her midwife that it was probably just a virus and to eat a popsicle. Eventually I was able to convince her to go to the ER. She was immediately rushed in the OR for an emergency C-section. Her placenta had abrupted and my niece was born not breathing, suffered several seizures and even died, and then was resuscitated. She is now 15 and has cerebral palsy due to going so long without the oxygen she needed. Edit, changed doctor to midwife. While mine wasn't that bad, I had nausea, dizziness, and vomiting. Went to L&D with BP like 89/59. And they just kept me waiting for hours. Didn't even give me steroids for lung development. Finally the baby's heart rate kept dropping, and they C-sectioned him out. Turned out my uterus had ruptured, so I had been bleeding internally for hours. My baby needed CPR and intubation, but we think he will be okay. He's 1 now. I knew I was at risk of uterine rupture and mentioned it at Tridge. The L&D stories duck 'em up. I understand that not everyone can have all good days at work and mistakes can be made, but come on. The stakes are a little higher for L&D. Doctors who bring lives in the world don't have a lot of margin for error. They just don't. It was a huge source of anxiety through my one and only pregnancy. My story isn't so much a misdiagnosis as it is just lack of explanation of events. Thought I was leaking amniotic fluid at 32 weeks. Got out of the shower getting ready for work one day and 2 spurts of liquid came out from between my legs. I went to my OB about 3 hours later and they did whatever internal tests they do to check for stray fluid. They didn't find any. I kind of convinced myself maybe it was water from the shower or I just peed myself a little and didn't feel. Either way, I was told if it was a leak it was not worrisome, and was told maybe her fingernail made a slight tear in the sac, and got explained to how, even when the sac does rupture in labor, how some fluid is retained, because the fetus can sometimes plug the leak. It all sounds like pseudoscience when I tell it, but I'd read more on it, and they seemed to be right. Everything was normal and fine until 39 weeks one day when my fluid levels should have been measuring at a 5. Not sure of the units of measure, or what this even means, but were measuring at a 2. Went in that night for the slowest induction ever, and didn't respond to any method for 3 days. After 2 heart rate drops by baby and me just getting increasingly uncomfortable and anxious. It was C-section time. Doctor said when they cut into the sac there was almost no fluid left. I was explained that a natural birth in that state would have been dire. but no one explained why I had no fluid left beyond there might have been a leak at some point, or at a certain point your body stops making fluid and can even reabsorb it. But none of that really computed, since I had been in the office every week for non-stress tests and the first time they found the low fluid was 3 days before her birth. I wasn't even over term. She was born at 39 plus 4, I think. And I had been on fourth fluids for 3 days and nothing was repairing itself in the slightest. None of it made sense, and I got nearly no answers about why it happened. There's a word for low fluid not associated with sac rupture, but I forget it now, and I was never technically diagnosed with it. I don't understand how L&D can be so cavalier about so many things that mean the world to mothers. Patient. When I was in college I went to the doctor because I was pissing razors. It progressed pretty rapidly, and by the end of the week I couldn't walk or sleep. The doc asked me about my sex life, and I told him the truth that my girlfriend and I had only been with each other and together for many years. He sorta scoffed at that and told me it was likely chlamydia. Had a long condescending speech about safe sex with me and sent me home. A week later my piss tests were back. Turns out I had the worst bladder infection they'd ever seen. I had to have a camera shoved up my pee hole, multiple rounds of antibiotics, and to this day I struggle to pee due to irreversible damage the infection caused. Oh man. That sucks. UTIs are rare in men, but super common for women. And I get like one every other year. I've gotten really good at feeling the beginning of one before it gets worse. And I drop everything and rush to urgent care. They hurt. Exclamation mark. I get them quite frequently, but I don't get the normal symptoms, which makes it hard to know when they start. The only normal symptom is that I pee more than usual, but I don't get pain until my kidney starts hurting. So then it's bad enough for the strong antibiotics, which then cause side effects. We figured this out when I was a kid, and now I just wait for my yearly infection and hope for the best. Not a doctor, but my mom went into a walk-in clinic and told the doc she had really bad headaches all the time. She was a stay-at-home mom to me, 10, and my sister, 6, so it was written off as stress and got a prescription for pain pills. 2 weeks later the headaches were migraines. Stronger prescription and try to reduce stress. A few weeks go by and she can no longer get out of bed. Throws everything up including the meds. Is completely disoriented and barely alive. My dad was a truck driver, so he was never home. I was taking care of me, my sister, and my mom all by myself. We go back to the doctor and this lady had the audacity to say this is the weirdest migraine case she's ever seen. Tells her to take warm baths and just keep taking the meds when she throws them up. 2 months go by and my dad came home. Saw the condition of my mother, who was so sick she would urinate herself. The house, which was being kept up by a 10-year-old, and said he wanted a divorce. That night we found out she had stage 4 lung and brain cancer with a tumor the size of an egg pressing on her brain, as well as many others scattered throughout. I still haven't forgiven that doctor for not taking my mom seriously. Edit. I figured I'd answer the questions you've been having here, because I'm on my phone, and keep getting lost trying to reply. As far as my mom goes, she fought hard for 2 years, eventually passing in November 2010. I was 13 and my sister was 9. My dad fell out of a tree about a month after her diagnosis and shattered his heel. He became disabled because of the surgeries it required and his back. He was a monster while I was home. All I remember from my younger years was walking on eggshells, constantly being accused of things I didn't do, and being watched like a hawk 24/7. I suspect he is bipolar and has severe PTSD, but you know how older people feel about treating mental illnesses. As for us, it sucked not having our mom growing up. She talked every day about how she couldn't wait to beat cancer and leave my dad, so we could all have the life we deserved. I think we turned out fairly well. I'm 23, have a family, move far away from all of those memories, and have committed to breaking cycles and loving my children the way I wish I would have been loved. I do wish I knew the doctor's name now, even though I know that it won't bring back my mom, make her diagnosis better, or even prevented anything. I still want to ask her if she started believing her patients. I think being a stay-at-home mom, previously poverty, woman has a lot to deal with how things went down. I wish no harm on the doctor, but I haven't forgiven her for not saying something about going to the Life is short. I learned that by watching my mom give up on every dream she had, because she knew she'd die. Go do scary stuff, because who knows what'll happen tomorrow. Close bracket. A dear friend of mine went to her doctor complaining of feeling full all the time. The doctor told her she was just getting fat. 6 months later, she went to another doctor who found stage IIIC uterine cancer, for which feeling full all the time is a symptom. Before she died 2 years later, her oncologist told her she would have had a much better chance of survival if they had caught it 6 months earlier than they did. Thank you for watching. We hope you enjoyed this video. Please subscribe for more videos.